Almost all depressed patients complain about a decrease in energy, which makes it difficult for them to manage their daily activities, work, family, and personal life properly. Depressed patients report sleep problems. In fact, waking up early is a sleep disorder that occurs at the end of the night when people wake up and think about their problems. The quality of sleep should be considered because it is very important and it is associated with many other diseases such as strabismus. We can differentiate based on the quality of sleep. Depressed patients are characterized by weight loss, decreased appetite, and decreased energy. Although a few may paradoxically express overeating, increased appetite, and weight gain. A depressed patient may sometimes even experience hallucinations and delusions related to their depression. This indicates a more severe intensity of the illness. Sometimes a person experiences delusions that don't match their depressed mood. They may experience grandiosity, something we don't expect in a depressed patient. In such cases, colleagues should be aware that the patient may have been misdiagnosed, and sometimes this patient mood swings like bipolar disorder and the like. It can also be a part of depression. The symptoms of depression in these people are not as common. They show themselves in the child in this way. A child is afraid of going to school and is more jealous of their parents. This attachment develops in adolescence, acting weakly in school, sometimes engaging in antisocial behavior, and sometimes resorting to substance abuse. It may manifest itself, and we should pay special attention to depression at the end of the age spectrum in the elderly, because statistically, half of the total population is probably affected by this. In these people, in this age group, the physical complaints are far more common than psychological complaints. They are more likely to complain about physical pain, weakness, lethargy, and conditions like this. And it is possible that some of us and some of our colleagues will treat it as normal and actually treat it as poison in the soil and provide the necessary treatment. Let's not do this in our medical history. Let's pay attention to whether this patient has experienced periods of elevated mood in the form of mania or pseudomania in the past. This is very important in diagnosing the disease and treating it. That is, if we are treating a bipolar patient. In fact, instead of a depressed patient who is actually bipolar and we diagnosed him as depressed and treated him, it is possible that the patient may actually have more problems. And with this treatment that we started incorrectly, we may mislead the patient and create a worse condition for him. Depression is a completely chronic disease, and its treatment is very long. Just like sometimes this disease does not develop in stages, and it takes a long time for this disease to develop. It can be treated over time. The treatment takes about 8 to 12 weeks. Treatment depends on the stages of the disease. What is important for us doctors is which patients we can treat and which ones we must definitely treat. For hospitalization, it's important to refer patients who have suicidal thoughts or plans. They need to be hospitalized. Patients who lack family support, those with a history of suicide attempts, or those with family suicide risk should be hospitalized. We need to ensure that those who require diagnostic assessments are monitored closely, and we should see them more frequently before starting treatment and making a definitive diagnosis. Our goal is to eliminate, not just alleviate symptoms. Why? Because symptoms need to be completely resolved, which is why medication must be prescribed for a long enough time. Depression is a chronic illness, and many suicides can occur in the context of this illness. Definitive treatment and diagnosis are a must, so medication must be prescribed for a sufficient period of time. Depression, which in fact many suicides may occur in the context of this disease, is a chronic disease. And it needs attention and treatment. It is not a disease that requires acute treatment to recover, like a cold or flu or some other respiratory disease. Many of these patients, they express that they've never experienced such a bad state before. That's why, alongside our treatment measures, we should also provide cognitive and psychotherapy for the patient. Naturally, supportive measures for these patients are also essential.